Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you with another segment from Portland, Oregon. And what I want to talk to you about today is something that we haven't quite touched on. We've talked a lot about recurrent urinary tract infections and ways to prevent them and ways to treat them and supplements to use and some of the causes. But recently, it occurred to me that we have not discussed some of the things that patients can have as far as other health issues and medications that can cause recurrent urinary tract infections. And I have a number of patients that come to see me, and they have chronic conditions like ulcerative colitis or rheumatoid arthritis or psoriasis or even multiple sclerosis. And a lot of these autoimmune disorders and chronic inflammatory disorders require medications like methotrexate and Humira, and some of those medications that are used to treat multiple sclerosis, and even inflammatory conditions where patients take daily prednisone and things such as that. So having said that, everything that we just talked about with these chronic inflammatory conditions can predispose patients to recurrent urinary tract infections because the medicines that they take also suppress the immune system, which makes a patient more susceptible to having recurrent urinary tract infections. Aside from just the basic inflammatory process of these chronic conditions, which obviously can predispose to recurrent infections, if you have chronic inflammation in one part of your body that is very difficult to control, it stands to reason you're going to have inflammatory response in other parts of the body that are going to be very difficult to control. If you further have medications that you're taking that suppress the immune system, then that's also going to be a source of recurrent infections. Some patients have diabetes, and one of the largest contributors to recurrent urinary tract infections is blood sugars that are out of control. Because if you think about it, bacteria generally love a warm, sugary environment. So whenever your blood sugar is out of control and you're spilling that sugar over into your urine, then of course bacteria has a much more hospitable environment to grow and reproduce and cause recurrent infections. I just want to talk to you about some of these things. If you are somebody that's struggling with recurrent urinary tract infections, one of the best places to start is, if you're diabetic, look at what your blood sugars have been doing. And if you're somebody that has chronic inflammatory conditions such as ulcerative colitis and rheumatoid arthritis and some of those things, or you're taking prednisone, start with looking at your medications and talk to your primary care doctor first about whether or not some of these medications can be causing or predisposing you to recurrent urinary tract infections by suppressing the immune system. So having said that, if your immune system is suppressed and you have any other source of infection in the urine, such as kidney stones or a urethral diverticulum or a bladder stone, or you're not emptying the bladder effectively, that is a perfect storm to have recurrent infections. So it's going to be really important to put it all together. So having said that, talk to your doctor, talk to your urologist. This may be something as simple as eliminating one of those medications if you can. If not, then it's going to be supportive measures, and some of the other things that we've talked about with prevention of recurrent infections becomes even much more important as a supportive and preventative measure. So I hope this helps. Hope this gives you a lot of basic information and places to start to take control of your own health. As always, thanks for writing in and sending your questions, and thanks for letting 360 Pelvic Health help restore your confidence.